Joseph is the co-founder and CEO of Healtheum AI. He's currently an undergraduate at Boston University, taking a gap year to leverage the power of AI to combat the growing inefficiency in urgent care sector. Back in high school, he invented a patented fluorescent immunoassay antigen test visualization device for over-the-counter settings and raised 2.1 million during the pandemic, earning recognition from Harvard and the FDA. Although the clinical trial eventually failed due to specificity issues, Joseph views it as a valuable learning experience. Joseph, welcome, and the stage is yours.
Hi, can you hear me, Dr. Yuli?
Yes, perfectly.
Well, good evening and well, good morning, because we're all from different parts of the world in this meeting. Thank you, Dr. Yuli, for inviting me to present, and thank you for the opportunity. My name is Joseph, and I'm the co-founder and CEO of Healtheum AI. Let me share my screen real quick here. Can you guys see my screen? Okay. Good? Okay, cool.
Yes, sir.
Right. So yeah, thank you for giving me the opportunity to present. We are relatively new. Healtheum AI, the idea kind of was founded a couple months ago. And we are in late stage ideation and approaching MVP ready. Yeah, so as Dr. Yuli mentioned earlier, I had a previous startup where I invented a fluorescent immunoassay test visualization device for OTC setting. So listening to Dr. Chris talking about LDT and CLIA lab was very familiar during that entire clinical trial process. So yeah, let's get started. So urgent care is under immense strain. We are seeing an ongoing decline in primary care physicians here in the United States, which is pushing more patients into urgent care settings. At the same time, urgent care clinics are operating with limited resources, outdated legacy systems, poor scheduling, and overworked staff. So when we put those together, we get patient experience compromised, lowered clinic throughput and revenue. So basically, outcome suffers for everyone involved. And with over 200 million urgent care visits annually and projected shortage of 3.2 million healthcare workers by 2026, this is not sustainable. So that is why we created Healtheum AI. Healtheum AI is an AI-powered intake and smart scheduling agent that sits between patients and urgent care clinics to optimize every step of the urgent care journey. Our system handles patient symptom assessment and history collection before they even leave their home. Then using real-time capacity-aware algorithms, we help route them to the clinic that is best suited to treat them. One that's not overwhelmed and has the right resources available and can see them quickly. We don't want people to go on Google Maps anymore and just type in urgent care near me and blindly go to a random urgent care just to discover that they are actually very overcrowded at this specific moment or doesn't have the resources they need. For example, lacking an X-ray machine for patients with bone fracture. So with Healtheum, patients are matched with the right clinic for their needs before they step out the door. And clinics are notified in advance, so clinicians are prepared. So, and by the time patients check in, the clinics are already has a clinical grade soap note ready to go. So providers can spend less time piecing together information from stressed out patients and more time actually delivering the care and doing the follow-up, whether it's diagnostics or imaging. I mean, the soap note on the left here is only for illustration purposes. It's an example of uncomplicated urinary tract infection. And what this means for urgent care clinics is very simple. It means higher throughput, fewer walkaways, fewer no-shows, because we're playing the intake, a conversational voice agent, right before you scheduling an appointment. So that reduces no-show compared to traditional scheduling software where it's more like open table. You just select a time slot and then end up not showing up. So by those interactions would reduce no-shows and of course better outcomes with our AI recommendations and all of which leads to higher EBITDA. Um, so yeah, here we have kind of like a brief overview of our market opportunity. We are like our current business model right now is sitting at $15 per intake. We are not set on this number yet, but it's somewhere around there from our existing research that we've done. And no major of course, tech overhaul required. Um, let's break down the market real quick. So there are over 210, this is a bottom-up analysis of the market size. There are over 210 million urgent care visits and growing per year in the United States. And at $15 per intake, that gives us a total addressable market of around $3.15 billion. Our serviceable available market is around 780 million, which is targeting the top metro areas and with the highest urgent care density in the United States, such as Greater LA region and New York. Yeah. And then our serviceable obtainable market is around 553 million, supported by a recent survey. 71% of Americans said in a 2024 poll by Ohio State that they want AI to help reduce wait times in healthcare, and that is exactly what we are doing. And for our go-to-market strategy, we're going to market in a dual strategy. On the patient side, we're building top-of-the-funnel demand through search engine optimization, SEO, social media, influencer credibility, and referral programs. And Healtheum, we want to bring this value proposition to the attention of the patients to become the trusted interface that helps patients to find the right urgent care fast in a smarter way. And then on the clinic side, we're leveraging, warm intros, some of the existing connections that we have are in Boston, Chicago, and the Bay Area. There are already 2 urgent care clinics that are already actively interested. We are in conversations with. We also are targeting urgent care associations, industry events, and doing strategic outreach to clinic operators on LinkedIn. And next, I'm going to talk about competition. So there are scheduling agents. I'm sure all of us are familiar with that, but they lack the AI-powered intake portion. And there are, B2B AI back office, clinical copilot, and scribes that summarizes patient provider interactions, but those don't really serve patients directly. They are not B2B2C. They don't have a 2C interface. And there are symptom checkers like Buoy Health, but they're not integrated with scheduling or clinic coordination. They're really a B2C giving patients insights on what they could do next, some recommendations at the end. So one recent example of a company similar to us is Paradis Health. And as you can see at the very bottom of this page is an AI phone call intake for primary care. They're also an intake agent, but how they're different is that patients have to book through traditional appointments, through ZocDoc, and in a traditional way, then get a phone call from Paradis AI agent after they make an appointment. It's more of a limited use case, but Paradis is also a very promising signal for us. Founded by 2 impressive Stanford undergraduates about my age, they got into Y Combinator late last year and announced earlier this week, actually only 3 days ago, that they secured a $2.3 million seed round in a span of only 14 days. So this kind of momentum is validating for us, and it shows investors are hungry for innovation in this space. And here's a brief overview. We are too early, to give a very detailed analysis of, ROI, but we do already have potential targeted buyers, right? So urgent care is undergoing rapid consolidation, meaning that efficiency boost is more imperative than ever. And also AI health tech merger and acquisition is very hot right now. The average revenue multiple is about 28.5 times. And it is the highest this year, 2025, among all other AI verticals. So there are clear buyers in this space because as we've all witnessed, of around 17% of urgent care clinics in the country are already private equity backed. And other buyers also could include EMR platforms, hospital systems like Kaiser, These players have all, such as Walgreens, they have all somehow interacted in a purchase of an urgent care chain or similar tools before. So with the trajectory of where urgent care is heading, we are confident that Healthium is a very attractive solution for them. So for the team, our founding team brings both domain. I'm Joseph. Before Healthium, as Dr. Yuli mentioned, I was the co-founder and patent designer of Orion Bio. We had a pre-series A of 2.1 million, and I am taking a gap year from Boston University. I'm a bio major, and my co-founder Matthew is a seasoned software engineer from currently working at Amazon Web Service and graduated from Virginia Tech with a bachelor's in computer science. And actually, we started off the entire project. We completely understand the importance of doing things with physicians and clinicians in a health tech startup. We actually started off with an MD. She is also a med school professor. But because of her other personal commitments, she recently stepped down. So this chief medical officer position is reopened, open again. But we definitely learned a lot from them. I mean, at least I got to know what soap notes were. And yeah, so and then we also have Brianna Sachi, co-founder of UberDoc, that we're working very closely right now, and she is also Boston's founder of the year. I had the privilege of attending her co-founder's masterclass at InnovatorMD last week by Dr. Muto. And yeah, so the raise, right? We are raising a 650,000, well, not 650, a $500,000 on a post-money safe note with a valuation cap of 5 million. But we're not waiting for funding, right? Matthew and I, we have this mindset that capital is only a tool. What we really want is to get to MVP quickly and get to product market fit, especially in the situation where we are not heavily regulated. So yeah, we are bootstrapping, and the MVP, the initial version, will be ready in about 2 to 3 weeks. And this is considered our pre-seed raise, our first institutional round, will be for MVP refinements and system upgrade from what we already have. Of course, minimum salary for my co-founder and I. Early go-to-market, a bit more than the typical 20% because of our dual strategy. We're not B2B, we're B2B2C. So we're going in two channels to acquire, customer like urgent care clinics and patients. And then also, of course, for legal compliance and operating runway, including buffer for any unexpected events. And yeah, to wrap up, I mean, urgent care could do a lot of improvements. I think we've all kind of experienced urgent care at one point in our lives. And Healthium AI is, the fastest and most efficient way to modernize how patients access care, and how urgent care clinics deliver care. So it's a win-win-win situation we're trying to create here. And we're combining, AI intake agent with smart scheduling in a way no one else is doing right now. And we're already seeing interest from the market. So if you're an investor, operator, clinician, I'd love to connect. Please scan the QR code. It takes you to a Google form that I made. And in that Google form, there's only two questions: the email and what best describes you, like an investor or a clinician. And then we'll get in touch with you as soon as possible. I mean, when I see the submission. Yes. Well, yeah, I'll open the floor to any questions. And thanks again.
Great. Yeah. Joseph, thank you. Thank you for an interesting product. So I'm trying to walk through the pathway. So let's say a consumer wants to set up an appointment, and then your app is going to collect the data, and then they're going to send the data, and then you're going to set up an appointment with who? How do you just direct them to an urgent care?
Sorry, can you repeat that? You kind of cut out a little there for me.
So how does it go? How is it going to work? In a B2C model. That's what. Can you walk us through the process?
Oh, so it's B2B2C model.
Oh, it's B2B.
B2B2C.
Oh,
So two
got it.
B, like two sides. So like, but it's completely free for patients.
Yeah.
We are taking a $15 per intake fee from clinics because we are not just, we are going to encourage their patients to come back to us and, give them a more efficient visit next time. But we are on top of that, also going to go out there and acquire patients for them on our two,
Got
yeah.
it. So you're going to be like an app that plugs into the urgent care system, and you become their scheduling system. And how does the data that you're collecting, for example, the clinical data, does it go into the EHR of the urgent care?
Right. So very great question. So there are definitely a couple steps in order to achieve EHR. EHR integration is definitely not, the immediate first step. Of course, for the first version, we are going to have a separate interface to the EHR, like our own interface that is used by clinicians. But with our pilots, with our early pilots, but we are aware from our conversations with clinicians, that physicians and clinicians, they always prefer when everything is in one place, right? And when everything is capable of being integrated into their existing system. That includes Epic or like one of the biggest urgent care EHR system, Xperity. But that requires definitely if we want to do read only, then that would be easier. But if we want to do read and write bi-directional integration, where our AI not only read patient information, but also pushes its own recommendations back into the chart, then that would be definitely something that is in our plan, but not the immediate next step for our MVP. Yeah.
Got it. Got it. I see Susan has multiple questions, so let Susan go uh,
Yeah.
first. Susan.
Okay, first of all, I don't know if you're aware. I'm a pediatrician for many years and I have an independently run practice. I'm not owned by a hospital, I'm not owned by an insurance company, and I'm very successful at it. Okay? Did it ever come to your mind that primary care providers are so angry that urgent care is taking away their business? Do you even understand that you have a very, very strong market right there that you can tie into primary care practices and say, hey, let me divert you to your doctor? Patients don't want to bother calling. I have a texting system in my office. I don't expect them to call. I tell them, you want an appointment? You text, and we get you in. And that's been very successful. We're always busy, and we don't have an empty slot. My colleagues go by phone call, and they're always hanging around. And if you're owned by a hospital, they're not going to go out of their way to say, come on in.
Yeah.
So you have an opportunity to make more money if you tie into the primary care market where pediatricians are complaining
Hmm.
about losing business to urgent care.
I guess the main thing would be freestanding primary care practices, right?
Exactly.
Even the hospital based,
Well, you
the
got to.
administration is always complaining. Why are you guys sitting around, the doctors and nurse practitioners, the PAs, where you can be that private push to bring patients in so they don't stand around?
Right.
Go
Um,
ahead.
Sorry, go ahead, Dr. Yuli.
No, no, you go ahead.
Oh, I was just saying, that's a very great point. That's something that Brianna and I, we were kind of talking about, my
Oh,
strategic
it's
approach for
not
doc.
just to talk about, you have to do it.
Yeah, of course. I mean, yes. She was definitely bringing to my attention that there are many primary care physicians that would be very interested in this, especially what Dr. Yuli mentioned, like independent. Um, and I think what we're doing right now is to kind of go with the general trend that we're not kind of forcing this trend, but it's like a natural trend because of primary care physician ongoing decline. We're going to have less and less primary care physicians. So that leaves a lot of Americans no choice but to go to urgent care clinics to seek non-emergency, because no one wants to go to ER for just anything, right? If it's not life-threatening.
Well,
So,
you're assuming a lot and you're assuming too much in the future. You got to solve the problem that's going on right now. The
right.
problem that's going on right now is the doctors are angry that
Mhm.
urgent care is taking away their business. And they
Right.
talk about this at all the medical societies. I used to be busy. Now they go to urgent care down the street. I mean, you're missing the picture. You can make more money by going to Northwell and saying to them, I'm going to fill your offices.
Mhm.
Got
I
it.
think that's a great point. Thank you,
Good
Susan.
point.
I will
I mean,
definitely.
I think it's a win-win situation. If you haven't thought about it, do it.
Good.
Yeah. Thank you very much. Yeah. Mhm.
All right. Are there any other questions from the audience? Um, okay. So here I have a question. Now I see that you are, collecting some data. So is it going to be a chatbot that's going to talk with the patient and collect the data? Is that what you're doing? Okay.
Right. Go ahead. Finish your question. Sorry.
And the second question, or the question is, can you customize that data collection to specific questions where the physician may be interested in some specific, let's say, there's a practice that specializes in something. For example, Susan specializes in evaluating children with learning disabilities.
Mhm.
So would you be able to incorporate a questionnaire in there that Susan has developed? That's my question.
Okay. Um,
Customize.
yes. So first of all, to answer your first question, our AI is just like ChatGPT. You text to it, but it really depends because there is a huge trend here in the Silicon Valley right now, including Y Combinator, about AI voice agent. AI voice agent is doing miracle, right? They're not just Siri level agents. They're actually talking to you, and you can't tell them from a normal person talking to you. Like you can interrupt them, you can you can't tell the difference. So these AI voice agents, definitely we will have two different modes. If you are out in public and you don't want to speak, you're at work right now and you want to go to urgent care afterwards, then you can text our AI, but you can switch with one tap to talking to our AI to either continue the conversation. And for the second one, I think that is definitely possible, because that is the difference between AI and form, right? AI is adaptive. AI, that's why Babylon Health, I'm sure you've heard of Babylon Health. That's
Yeah.
why they eventually went bankrupt. I always say that if Babylon Health was founded after ChatGPT, their AI wave, they would have not gone bankrupt because they started a decade ago claiming it to be AI, but it was only a decision tree. So they
Yeah.
were hyping their technology way too much. So a decision tree, like a form, and AI has huge difference in terms of personalization. Um, so yeah, I think what you just mentioned there is definitely possible. Thank you. Yeah.
All right.